My dear friends, thank you for being here. I have the honor of entertaining the after-lunch crowd. So you only know how easy this is. But I'm really dependent completely on our guests here, in which they are going to help energize the session even more. So the whole day we are talking about data, and the data is very exciting. Actually, at the other side of the sessions here, we are having a big data conference, which complements this really, really nicely. So here we talk about how can we deal with the data, what are we going to do with it, and we saw wonderful presentations, really spot on. And the other side of the shop in the conference, they are speaking about how can we implement it, how can we implement the vision which is being developed by this group of people sitting directly in this room. So for this, I thank you. So part of what we are doing really is to move data into information, yeah? Really, because the data, with my white hair, I've been housing data for the past 43 years, okay? So what did I do with it? I need people to make this data information by making it talk to each other, the data, so to speak, and come up with a better utilization of the data, indicators to help us all over the world. What are we going to do and how are we going to do it better? I'm really grateful for this opportunity to be part of Health and Human Services. I have law enforcement background, and I don't mean to be a cop, but I'm on the other side because I'm the brown guy, So every time I work in the law enforcement, which I served in the Department of Justice for years, we have a great utilization for the data. We are running very sophisticated shop in the law enforcement community. And you can know this if happen, hypothetically speaking, it never happens to us. Hypothetically speaking, if you are speeding and you get stopped by CHP or others, they usually ask you for your driving license, and then from your driving license, they look at the image and they look at you, and they go back again to their office, which is the car or the motorcycle. And then they look and they start retrieving data about you out of the driving license. Yes? So you have experience, huh? Oh, yeah. So what happens actually in the Department of Justice? When we get this information from you, we don't retrieve the DMV. We retrieve something called CalPhoto. And this is California image system, in which goes out to the DMV and grab your image, usually grabs the top 7 images, okay, and make sure that the top one similar to the one, so we know that you are the lead person. From there, start going through 42 databases, local, national, and some of them are outside of the country, actually, to verify that you are the person and nothing behind you in terms of legal in the country, whether you have a restraining order, you have a child molester, and things like that. So the data in the law enforcement community is really, really advanced. And I'm glad that in Health and Human Services, we are taking the proper strides toward moving forward with this. So part of the implementation that we've done, that a group was created for open data portal study to see what can we do really to take strong steps toward moving this data forward to benefit from this information. So group was created around October, November last year, around this. Would this make sense? Okay. And the group was between 20 and 25 members. Andy was sometimes on the phone. Most of the time he was slacking, He wasn't on the phone. But Daniel was always on the phone, And the group created really a lot of phone calls, and we met a lot, and we end up with about 3 active groups, very active groups. One of them like a policy and principle group, one of them is data sets and principle groups, and one of them a lunch and planning group for us to come to this day. And we generated some keyword products led by Daniel and his group. Thank you for this, Daniel, One of them, the pre-planning for this event, and user engagement, and the involvement that you have been all involved part of it. And created some supporting materials that all of us we have in hand and other materials on the website, but also included an open data handbook that all of us we have it. So with this said, I would like really to turn over to our wonderful guests here, and I will let them introduce themselves, but I would like to mention very quickly that Dr. Bosworth You know, thank you very much for coming from the governor's office. We know how extremely busy you are. We are grateful for this. She's going to talk to us about the vision and how the governor's office is heavily involved and see vested value in what we are doing. And my dear friend, Dr. Gargatia, and I will let her introduce herself. I would love to introduce her, but I decided to bow out, and she will do this. And I will sit. And after that, we'll take questions. Thank you very much.
Thanks, Nabil. You guys know me. I have to say, if my voice shakes at all, I've been shivering. I'm not actually nervous. I found you all to be very friendly. Just waiting for the next menopausal hot flash to warm me up. But my job here today is just to take a few minutes to tell you about the Health and Human Services Open Data Portal Study Group's findings, which is a mouthful, and our recommendations for moving forward. So what I first want to let you know is that to do this great work, we've actually shared the collective intelligence of a number of great minds. And while I'm not going to read all of the names here, what I'd like you to get a sense of is the breadth of experience that we're drawing from, as well as the diverse areas of expertise and the cross-cutting level of collaboration among government and non-government entities. And I just have to say personally, it's been a true joy to learn from this study group. And I particularly want to thank Stewards of Change as the project managers who have convened and exceptionally facilitated this group. So in this presentation, I want to focus on summarizing our progress in learning about open data and the many areas of this project that require really very careful and deliberate thought, I think, as you've heard throughout the last day and a half. And then I'm going to end with some recommendations and thoughts about our next steps. Well, we paid a lot of attention up front to how an open data platform could best serve the needs of our organization. And we asked ourselves what kind of requirements we had for such a platform and how we might want to use it. So ultimately, we learned that Socrata is used by a number of other governmental agencies who have shared with us in the last day and a half, and is essentially a turnkey product, meaning that it's ready to go right away, out of the box, and we wouldn't need to have to do our own programming in this just to get the system up and running. We considered that a good thing. And another major benefit that we really paid attention to was that Socrata does offer professional services and support. And as you know, the concept of open data is pretty new. And Socrata's been working with government and open data for 5 years now. And they bring significant experience, I think, to the picture in terms of implementation services, training so that you can be sustainable and keep this going, and even things like branding and marketing of your portal. So we thought that those would be extremely beneficial for us. And even before this Open DataFest, we've learned some significant lessons through the experience of others. And many of these are you in the room who have shared with us, so we really appreciate that. And through those inquiries and this event, we've gathered quite a bit of knowledge. And content determination and creation has been discussed, which I think is important. The development of policies and how we do this around open data sharing, how we share across agencies, how California could leverage those things are all parts of the puzzle that we've been learning about. And so we've thought a lot about how do we identify the data sets that should be considered for the portal? And that's been talked about in the last day and a half as well. And I think you've learned, as well as we have, that there are a lot of ways to think about this. And we've heard throughout the last 2 days that you could look at data sets that are high in demand. And we look at these as ones that may be often requested by hits to our website, or those that we have a number of media requests for, or Public Record Act requests. Those would certainly fit as high demand data sets. There are also data sets that may have high leveraging value. In other words, they may support strategic goals and interests that we have in our organization. And so we've thought about those issues and what kinds of strategies we may have. And then there are data sets that simply are really good at engaging the public and getting them involved with public health and our online presence. And finally, there are data sets that help to solve some particular problem or inform a policy that we may be interested in. So now I'll get a little more specific, because we actually have talked about the data sets that we may consider early on in an open data portal if, as California considers the proceedings. So ones that have been suggested meeting some of these criteria that I've just mentioned would be birth data, for example. So my shop in Vital Records has 22 years worth of birth data that we have in PDF and Excel spreadsheets on our website. And they're aggregated by zip code, and so that would be one particular data set that would certainly fulfill the high demand criterion, because we get public records requests constantly for birth data. So that would be one. Another one, our partners in the Centers for Infectious Disease experience high demand for their sexually transmitted disease data. And so that would be another one that we would consider. There's also a lot of data that's already available online, but could be packaged differently in an open data portal, and that is the healthcare-associated infections data. And those are really good indicators that we feel could be leveraged to improve clinical care. And then there is a Healthy Community Indicators project that you may have heard about in California, and it's creating a number of really good indicators. And those indicators are linked to the Healthy Communities framework, which is derived from our Health in All Policies task force. And so we think that adding these indicators to the portal would be useful for planning healthy communities and our projects, our policies, the environmental changes that would be happening in terms of community health. So we've realized that not all data sets need to be about populations and their personal health, but there are actually other data sets that may include directories, lists, and resources that could really help people navigate certain systems more effectively. So we're also considering those kinds of things for the open data portal. And finally, there are data sets that are simple and simply seem to resonate with the public, like the example that we've heard about from New York, the baby names, the most popular baby names by county. So some of those you might almost say no-brainer, but important data sets that really get the public engaged in our work. One of the very rich areas of discussion in our study group was the conversations that we've had around principles and policy. We covered a lot of ground here simply by trying to clarify for ourselves what our expectations are for an open data platform and defining the expectations of our stakeholders and what should they be able to expect from us now and over the long term, because sustainability, as has come up here, is always an ongoing question. And we've discussed governance issues and how it might work specifically in California. We always like to think we're very different from everybody else, and maybe we are, maybe not. But we began to think about some of those issues. And then we began to outline our goals for California. Simultaneously with our goal setting, we had to do, as Daniel mentioned in the very beginning of this event, and that is to begin with the end in mind. So we started thinking about the end. What would success look like if we stand up an open data portal in California? Well, when we think about this internally, within the Department of Public Health, as being a demonstration site for an open data portal, we begin to think about how we may see increased efficiencies in government. As I mentioned a few minutes ago, just by not having to create custom data sets in response to the myriad media or Public Records Act requests that we get, and you've heard that same experience mentioned here before, we expect to see those efficiencies. And we also expect to experience a streamlined management of data with increased access, more timely updates, and certainly more efficient exchange of data. And if we think about some of the more external views of our success, our study group considered that evidence of interagency collaboration on things like data standards, implementation, and coordination would certainly be a big win. And we also felt that showing a higher level of engagement with a vibrant user community would indicate that we've succeeded in this endeavor. And I think we've talked a lot in the last 2 days about how we engage our stakeholders in the public. So then what were our recommendations for next steps? Well, in the very basic sense, we felt that we needed to effectively synthesize all of this massive knowledge that we're gaining in ways that will serve us in terms of creating our own process here. But we also need to develop an education and communications process as a way to broaden our understanding throughout our own agencies and departments, as well as others who may want to get involved. Our study group also thought that it was critical to have a solid plan for nurturing engagement, as I've mentioned, and this goes back to how we continue to strategize and prioritize those high-value data sets for release, as well as continuing our convenings as a study group and enlarging and expanding that to share ideas and best practices. And as we've heard about, there are many ways to reach out to promote public interaction by soliciting ideas and feedback, as well as organizing events to promote innovation. So one of the areas that I think we found challenging was the clear articulation of benchmarks or metrics that could be used to evaluate our success. And we need to identify milestones along the way, for example, at 6 and 12-month marks. And I'll just put in a plug-in for the last session. We're going to be very interested to hear from you on this one, because you're going to be asked to consider what kinds of metrics might show how successful an open data portal could be in California. Because, after all, in the end, we want to own this face of pure accomplishment.
Hi, I'm Louise Bosworth. I am the Deputy Director of the Governor's Office of Planning and Research. And I'm at a deficit because I was not part of the study group and working group, but I am stepping in for my colleague Allison Joe, who's the Deputy Director of the Strategic Growth Council, who was. But I've been working very closely with her on a lot of data issues, and so hopefully we'll be able to provide that insight on sort of where we're coming from the outside of Health and Human Services, sort of on the bigger picture of data across the state. Just for a bit of background about OPR and the Strategic Growth Council, the Office of Planning and Research, or OPR, is part of the Governor's Office, created in statute in 1970. And we really serve as long-term or long-range planning and research resource for the Governor and the Cabinet. In 2008, statute created the Strategic Growth Council. They coordinate activities across state agencies to promote basically sustainable community planning in the state. There are 8 members, 7 agencies at the secretary level. It's chaired by the Director of the Office of Planning and Research, and there's 1 public member. And another responsibility of the Strategic Growth Council is to coordinate data to further its goals. I was going to talk about basically how open data and data availability fit into the state's long-term goals. What are some of the current activities happening at the state level to try to coordinate across state agencies? Talk about a few examples. I think we have a lot of neat examples of where we're putting information and data out there, and I think part of our next steps and what we're doing right now is trying to think about how we connect those pieces, how closely they need to be connected, but how they fit together. And And so just to give you a bit of background and sort of from a very big picture, high level, one of my responsibilities at OPR has been to be drafting the governor's environmental goals and policy report. And this is a document that our office is charged to create, and it's supposed to be maintained and updated every 4 years. It hasn't been done in several decades. But the last one that was done and adopted was created by Governor Brown, and that was an urban strategy for California, and it laid out an action plan for how to make vibrant, sustainable cities in California. And so we decided that it was time to revisit that document and think about what do we want the state to look like. And we looked at, in the context of 50 million residents, so that's about in 2050. So California at 50 million, what do we want to do? How do we want to meet our environmental goals, accommodate that growth, maintain a strong economy? And this document lays out not an inventory of our goals, but really tries to look at, because we have no shortage, as I'm sure all of you know, that not just a list, a laundry list of what our goals are, but how do they fit together and where are they taking us? And I think one thing that becomes very clear when you do this is what we're looking at accomplishing as a state over the next several decades, whether it's through sustainable community planning or what we're doing with transportation and energy. These are big challenges, and they're going to require a lot of cross-sector coordination across different scales, different topics. We're going to need a lot more data, and a lot more data is likely to become available to us. And so this is all, in thinking, that's a key component of what our future is going to look like. So when we look at our cross-cutting goals as a state, we identified 5 broad, very broad goals. And I know they're not all relevant for an audience, but these are for this audience, but these are our 5 goals, which are really decarbonizing the state's energy and transportation system, conserving and stewarding natural resources, supporting sustainable communities, building climate resilience into all of our policies, and then fostering cross-sector collaboration and data sharing and availability as one of our cross-cutting goals for the next several decades. And so thinking about how we do that and what that actually means is something we've been spending a lot of time on. So currently, there is a broader conversation across state agencies around open data, around data, and really it's in its early stages. It's been convened, being led a lot by the Strategic Growth Council, OPR, the Government Operations Agency, and really trying to think about, in the early stages, inventorying our data, thinking about standardization of methods and approach of common metadata across all of the data sets. And I have to say, we've had several meetings, and each time new people are coming to the table. So that's really exciting, and I think we're really starting in the early stages to wrap our arms around what that looks like. We have many ongoing efforts, and I'll run through a few of these because I think they are really great examples of what we can do. We just heard about the Dataportal work that's happening. We also are doing a lot of work more generally around indicators and metrics, and this is linking indicators and metrics to those goals in the Governor's Environmental Goals and Policy Report that I just mentioned, but also that the Strategic Growth Council is doing around regional progress and with the healthy community indicators. I'll show the example also of the Geoportal, which is a way to make all of the state's geospatial information available. A neat example with state building energy data. And there are many more, but those are just a few. So with indicators and metrics, we're really trying with the Environmental Goals and Policy Report to identify state-level indicators that help us understand how we're doing towards accomplishing our goals. And I showed those 5 cross-cutting goals. And so if we think about the first one, which is decarbonizing transportation and energy systems in California, we've identified a set of about 8 metrics that we have laid out, and we have how they relate to our goal, why they're important, how we're doing, and what the next steps are. And these are very static at this point, but are up on the OPR website and slowly being developed. We're working, I'm sorry for the font changes there. We're working on this to think about how we nest and coordinate these indicators across scale, thinking about the state level with the EGPR, at the regional level with SGC's Regional Progress Report, and then tying in the healthy community indicators work that Esty mentioned that is being supported through the Strategic Growth Council, ties into the Healthy Communities framework developed by the HIAP task force. We also have the California Geoportal, and the goal here was to make all of the state's geospatial information available in one place so that you could go there and you could get what you need. This was developed by the California Department of Technology with support from the Strategic Growth Council and OPR. And one of the first steps in this process was a letter that was sent around to state agencies to inventory what geospatial data, how many, what layers were out there. And through that process, I think hearing from most, more than 3,000 layers of data were identified. And obviously, this is a tool that has many applications and extensions. This is just a screenshot of what the Geoportal looks like, where you can go in and you can search with key terms and find what you need, download the data. But it is also, I think, what's really neat, again, sorry for the, is the different applications that this leads to. One that our office is working on is a tool for the development of general plans, which are the long-term documents that guide development in cities and counties required in every city and county in California. One of our big challenges is we need those documents to be updated. We need general plans to be current. We need them to be up to date and thinking about the kinds of issues that we're all thinking about and concerned about, whether it's healthy communities, climate change, resilience. And so we're in the process for the first time in a decade of doing a comprehensive update of the general plan guidelines and working with the technology department to develop a tool that enables cities and counties to pull the data and the maps that they need, that they're required to include in their general plan, into one place. So this is just a screenshot. It's hard to see, but this would be for Irvine. It shows fire risk. And so this is a kind of map that they can pull into their safety element of their general plan. And so the idea is here we're making it easier, we're making the data available, and ideally we're lowering that activation energy or that hurdle to getting those plans updated. We've also developed sector-specific viewers, a coastal viewer of geospatial information, and it's also just a really nice entree point for viewing other data in a geographic way. And so there have been tie-ins to some other applications. Final example I'll show, I think, is a nice example of showing transparency and potentially a model when the state is wanting to model certain behavior. And this is data on energy use in state buildings by department. And this ties to the governor's executive order on reducing energy use in state buildings. And it shows where our goal is, how we're doing as a state, some of the best performers, and down on the red, some of our least good performers. But anyway, the idea here, this is a first iteration of this, and there's a lot of work happening on how do we allow people to dig into that data, how do we use it to help identify opportunities for where we can be making, getting a lot of gains and bang for our buck in improving building energy efficiency. And like I said, so when I started to pull this together, I think it is very exciting because I think there are a lot of great examples. Another one I'll throw out there is CalAdapt, and this is a tool that allows local governments to look at climate impact data at a scale that's relevant for them. It takes all of the data that has been developed through the state's climate change research program and puts it into one place. It's tied together with an adaptation planning guide that helps cities and counties understand how they can start developing an adaptation plan, and here they can start pulling data. And so other coordination that's happening has been between state agencies and metropolitan planning organizations and with the state and federal government around transportation indicators for MAP 21 and also some indicators on climate change that we've been working on. Just a few final thoughts. I think one thing that's very clear is that data, tools, and access points are being developed throughout state government and state agencies, and I feel like we're learning about new ones and new efforts every week. And these are enabling us to link our state goals to the progress that we're making. They're helping us, like in the example of the general plan guidelines, help to facilitate and make planning easier, and also to help us do more strategic planning, perhaps around state buildings and energy efficiency. And those are just some of the great examples in transparency, modeling behavior. Going forward, we're continuing to collaborate with really an idea of information sharing. And I think some of our early goals for the group that's working across state agency is, as I mentioned, to inventory data, think about how we can standardize and how we can coordinate these tools. Excuse me. And I think one idea, we definitely, we look to Maryland's example, and we're all, especially in the context of the governor's environmental goals and policy report, we would love to have something like that with our broad overarching goals. And to think about how, if we do something like that, we can connect the dots between these different efforts. And they don't all have to be the same, and they don't all have to be in one place, but how do we show the coherence and how they relate to one another, I think is our next big challenge. So thank you very much.
Thank you so much. This is really very informative. It's really great to see the governor's office and how the strategic vision and how the plans is going on a strategic level. And then it comes to us, we start focusing on the tactical level, so to speak. And it comes to the data housing, like me as a CIO, start working on the operational level. So thank you very much for the glimpse, and thank you, Doctor, for sharing with us. So, thoughts? Well, Cheryl, you're one of us. You shouldn't be asking questions. Okay, ask question.
Just a quick question, Louise, of some of the great tools.
Okay, the phone is coming, the mic is coming your way.
Okay. You mentioned some really great data tools and access points and ways you're framing the information for users. Are any of those being updated kind of continuously? Are they static and then just updated, or are they being revised dynamically?
I think that's a good question, because that is a challenge. I think the Geoportal, it's access to data, but it is being I think as new information becomes available, and the ability to link to other types of data, I think that's constantly being incorporated. Another example, on the building energy, that right now is a static site. I think the idea is to try to get something a bit more interactive. CalAdapt is in the process of being updated, and once it is updated, it's that has, I think, been an example too of the sort of the stewardship commitment to doing this kind of work, which is that you have to be able to keep that information up to date, because especially with climate impacts data, we're constantly getting new information and new tools, and so how do we incorporate that? So it's a mix.
Okay, so I have a question, so I mean, I don't mean to put you on the spot, but this is helpful for me, because as a CIO, my focus always, besides making sure that the data is protected and the appropriate data goes out, every time I try to move and say, oh, let us do it, let us move. So I have to deal with the governance, which I have great respect to this. But I need some help, a little bit understanding to temper my excitement about implementing. And is Larry Baldwin here? Where is Larry? Okay. Oh, hi, Larry. How are you? This is Nabil. Okay. So Larry's telling me, Nabil, you have to get a legal opinion about this, and I said, okay, I got you, Larry. And then the business community come and say, okay, this is really great, but I need to tell you which data needs to go out and which data needs to come in. And I'm saying, okay, guys, I'm pulling my hair. Why didn't you come together as a governance body and talk to me, what's the praiseworthy? How can we move this? So maybe if you can share with me some of your thoughts about the governance body, how does it work? How do you envision the interaction? What do you think the stakeholders sitting in this body, providing that they are not 25,000 members, otherwise we will get into nowhere. So please share with us some of your vision, please.
Sure. What I'll share with you is sort of an outline of what we're thinking of, and we certainly intend to steal from all of you who have done this and make use of that good knowledge. But within the California Department of Public Health, we have a body called the Public Health Informatics Advisory Committee, or FIAC. And that committee is meant to do these kinds of things. And the committee can assign work groups to particular projects, maybe things like small cell estimation or other kinds of data-related things. So we expect that through FIAC, we will probably have an open data work group that would serve as the initial governance body. Now, that work group is going to be advised by a process that we will have set up in advance that is going to help us to understand how we assign data standards to the whatever data set we're working with, and we'll have a method for collecting metadata in a prescribed way. And then this body is going to also tackle the legal issues that may be associated with any data set, the public relations issues. We're going to want to consider that. So this body is doing what informaticians or informaticists do, and it brings together all the experts so that we can communicate and figure out everything that we need to know about a data set. Then our Public Health Informatics Advisory Committee reports up to our Public Health Policy Committee, and that Public Health Policy Committee is the overall policy governing body at the California Department of Public Health, and is chaired by the director. So that's where final decisions get made. But then I envision, as we think about, and we've discussed here in the last 2 days, CDPH we have a lot of data, and we certainly are interested in sharing it, but there are a lot of other departments within Health and Human Services that are also interested in being a part of such a project and want to share their data. So I've described to you what our smaller governance piece is, but I think that there's also a higher level governance body, and I think there are also always or simultaneously occurring discussions about that. We do have a data strategy work group that has been convened at the agency level, and that work group may sort of be the initial body that starts the overall governance plan for Health and Human Services. So that's what we're thinking about.
Thank you, Dr. Bosworth. We have 1 more minute.
Oh,
if you care to share your vision with us, I'd be grateful.
Yeah, I shouldn't take more than a minute because I have to say you're much farther along. I think this is a conversation that we've just started having, and I think what we are starting to try to think about is what do we want to address through a governance policy. So I think whether it's issues of data sharing, of how across agencies, I mean, you were talking even within Health and Human Services, but I know in the work on the Healthy Community Indicators work, that draws from outside of Health and Human Services. So how do we, and so I think that's really what we're trying to grapple with, is what do we need to address through that governance policy? And we've been talking with folks around, what does that even look like at a state level that we need to be addressing there? And so that's kind of where we are, which is in a much earlier stage, I think.
Thank you so much for sharing your thoughts. Thank you all for being here. Andy and Daniel, thank you for the opportunity. Thank you.